First of all, this bill is called the Women's Health Protection Act. I believe Congressman Raskin and Congressman Cole both mentioned that. And the stated purpose of the bill is, from my colleagues in the majority, is to increase access to women's health care and protect women's health. But Ranking Member McMorris Rodgers, that's not really what this bill is about. And I'm just going to mention a few of the provisions of this bill and just kind of curious how they affect, if you have any answer to how they would affect and improve women's health and health care for women. Section 4A1 bans ultrasound requirements when seeking an abortion. Would that have any reasonable effects on women's health?
No.
Section 4A6 bans regulatory requirements for facilities that provide abortion services, such as staffing and equipment standards. Do you think that would have any, maybe even have an adversarial or adverse effect on women's health?
I agree.
And then, this bill also, and I think you mentioned, both you and Congressman Cole mentioned that this removes any conscience clause for healthcare providers who choose not to participate in abortions. And in essence, they would be forced to perform abortions regardless of their personal religious beliefs. Would this provision have any reasonable effect on improving healthcare for women?
No.
I would like to point out that this bill voids all state laws regulating abortion, and I think that's been mentioned a couple of times, whether past laws or future laws. And I would just like to mention that I think we're seeing a pattern from the majority of usurping states' constitutionally granted powers, and I think, Ranking Member, you just mentioned that Roe versus Wade left a lot of it up to the states. And now this legislation would be just usurping that power and avoiding all of those laws. And I am concerned that this bill will void and prevent in the future legislation that would actually help women. And I think that as we talk about that, maybe some of the things that we should be looking at, what about protecting minors? There's been some discussion about minors, and would the states be allowed to ensure that a young person notifies or obtains any kind of parental guidance before having an abortion?
No.
And would states be allowed to ensure that a minor's parents or guardians is notified of this medical procedure?
No.
Finally, would states be allowed to ensure that a minor's parent or guardian is notified if the abortion is as a result of rape, incest, or the minor suffers from any kind of physical disorder, injury, or illness that would place her in jeopardy?
No.
And so do you, Ranking Member, have any thoughts on, does that provide any help to women for their health care or improve their health at all?
No.
And Ranking Member McMorris Rodgers, we are towards the end of the fiscal year, and there's yet to be an agreement on the appropriations packet for this coming year. We have serious issue relating to our national debt that needs to be addressed by October. Inflation is at an all-time high. Unemployment is a serious weight on our recovery, on our economic recovery, and we have the Biden administration's disastrous handling of Afghanistan, and we have all of these issues that are demanding our immediate attention, but yet we're taking up, in my opinion, Planned Parenthood's wish list. Does the House taking up this bill give you any confidence as to whether we will be addressing any of the other timely issues that need our attention?
Mm-hmm. Well, this is a statement of priorities by the majority, and this is on the list. The decision was made to bypass the committee, not even to have a hearing in committee, because for whatever reasons, the bill needed to be on the floor this week. I view this as a sad day. It's a sad day that in the desire to be able to fulfill a political agenda, that this bill is being brought forward in the manner that it is, and bypassing committee and being brought directly to the Rules Committee for floor action. It's not the way to legislate. It's not the will of the American people, and it's really a sad day.
And thank you, Ranking Member. And this really is, and I would agree with you, Ranking Member, this is a sad day when we are, first of all, taking this up when there are so many other pressing issues, but in addition to that, we are stripping those states of any of the protective legislation that they've put in place to protect children, to protect women from dirty facilities like we saw a few years ago, any of those things that they've done. And I have real concerns that this is the direction that we are taking, and that this is the kind of, not only are we just, we are forgetting to protect women just just for the sake of promoting abortion and making sure that it is available 24/7 for any reason, any way. And in addition to that, this kind of agenda is sad when we're moving this forward. And I just wanted to ask you just finally, if there's anything that you want to add. I know Mr. Morelli had made some comments, and I saw a little bit of a movement to make some comments, but if there's anything that you would like to add.
Yes. I can only imagine the fear of the unknown when someone finds themselves facing an unplanned pregnancy. There's a lot of unknowns. A lot of fear, a lot of, considerations. And the idea that those of us on the Republican side of the aisle don't care or don't support services, I do take objection with that statement, because we must surround these individuals with love and support, and with services and with financial support to help them in that situation. And I can point to a lot of work that I have done, both on the private side, without, not taxpayer dollars, but also supporting programs here in Congress to help single moms, help low-income families. I don't believe that that's a partisan issue. But I have fundamental concerns, and I am opposed to a bill that's going to allow an abortion in this country really based upon sex, race, disability, and without the ability to really take the time for us to maybe have an ultrasound or learn more about that pregnancy before making a decision out of fear. As desperate of a situation as that is, I want to make sure that we are actually surrounding that individual and providing support and not encouraging abortion on demand, which I believe this legislation does.
Thank you, Ranking Member, and I do appreciate and I appreciate the passion that you have in protecting those women and helping them through a crisis pregnancy. And with that, I yield back.
Madam Chair, can I
The
correct
gentlewoman
something?
yields back. Mr. Kosky.
Thank you. No provider is required to provide an abortion. It's just not true that somehow doctors or providers would be required to perform abortions. That is not in this legislation whatsoever. And let me also say that the bill is intended to ensure that anyone can access abortion services without unnecessary restrictions. And so some of the items that you talked about are just completely unnecessary, and as I said earlier, really stand in the way of a timely and safer abortion. I yield back.
Madam Chair, may I just respond very quickly?
You're recognized.
Madam Chair and Madam Chair, I guess I do see regulating the clinics and making sure they are clean facilities, which is now at the state level, is necessary to protect.
This wouldn't
health.
change building
We
codes.
will, let us
sorry.
pause.
But
We
would
cannot
like
do
to
a back
add
and
that.
forth
Sorry.
out of respect,
And thank you very much. I appreciate the time.
Can I just respond then to
The
that?
gentlewoman yields back. I'm going to recognize my colleague from California, Mr. Desaunier.